So in order to ensure a mechanically specific and precise adjustment within the Gonstead approach, part of our analysis involves using a little instrument that detects thermal changes along the spine. So this particular instrument is a Delta T model, and there's little thermocouple wires, just one actually, and it just picks up heat. So the reason we're going to use this along the spine is we want to detect bilateral heat differentials where there is pressure on a nerve resulting from a subluxated joint. So this is what it should feel like, just two little probes running along the spine. And he or she will go over that probably quite a few times in order to determine where they are finding pressure or disturbance. Right there we have one. So we'll put a little mark and we'll continue down. Now that's a good example of what the doc is looking for, is a temperature swing, just like that. Now there's different models of scopes. I've got two just to make a demonstration. This is another, what's referred to as a temposcope. There's also a nervoscope, but it's the same thing. It's just a different model. And here we want to just try and reproduce what we're finding. See, that's a temperature swing. And then we'll keep going down. There we go. They're similar. The readings are similar with both units, which is important. Here's what we're actually measuring or identifying. This is just a cross model of two vertebrae and a disc, and the relationship that these 31 spinal nerves have in connection with our spinal cord, which is literally part of our central nervous system. If there is a disturbance in a joint, a subluxation, that'll create inflammation somewhere on that disc, on one side or the other. These spinal nerves are in close proximity, and once that disc is disturbed, there's a process of inflammation. All 31 spinal nerves have a sensory branch that innervates the back of the skin on either side. So once there's a disturbance occurring in the spine, through that sensory nerve, inflammatory properties are brought back to the skin. And when we run that little instrument along the spine, we can actually identify the precise level of where that nerve disturbance is. Okay. It's also important that the doctor has the patient in a gown. That way we're able to use that instrument and actually run that along the spine, as well as the doctor is going to palpate and feel. But this is a very important piece, of the Gonstead workup. So having a gown is important. All right. Now we have the patient on what's called the high-low table, and we are going to make these two adjustments. We're going to adjust this level first. So we're going to just count down where our subluxation is. And an adjustment, the patient should feel a very specific contact point that the doctor has. And when that adjustment is made, they should feel just one movement on that one level. Just like that. That was good. So now we're going to adjust the patient's neck, and we've identified the level that's involved, and you'll find that your chiropractor is going to just put your head through small little movements to try and identify where the greatest amount of restriction is on that level. And that should be consistent with an x-ray. And within the Gonstead system, we always have an x-ray up, and it's a full spine film. And we have that available to identify what's consistent with what we find on the patient. So once we've established how that needs to move, we will adjust this. And a Gonstead neck adjustment primarily is done in a seated position. We want to lift that segment up. We want to move it in 2, sometimes 3 different directions. So in order to do that, the seated position is best. It's very possible that we could also do that laying in the prone position, but we always try to do that seated. So a cervical chair or neck adjustment will be just like this. This is how you'd be sitting. And the provider is going to reach around and just get you in the right position to make that adjustment. There we got it.